Good morning, everyone. My name is John Knox. I'm the Principal Deputy Assistant Secretary for the Administration for Strategic Preparedness and Response. Sorry, it's always a tongue twister for me. On behalf of the U.S. Department of Health and Human Services and Secretary Robert F. Kennedy, Jr., I'd like to thank all of you for being here today and joining us for this event. I want to take a minute to talk about, to thank all of our federal and private partners who played a role in this morning's announcement. This includes the U.S. Department of State, excuse me, the U.S. Department of Transportation, and MRI Global. Today, HHS is launching its Portable Biocontainment Unit, or the PBCU. This is a new capability facilitating safe and effective transport of patients with suspected or confirmed high-consequence infectious disease. Today, the PBCU offers long-range domestic transport of multiple patients that have been diagnosed with some of the world's scariest known pathogens. Think of things like Ebola, Marburg, smallpox, and MERS. All of these diseases are highly contagious and can be deadly. This unit can safely transport patients by ground and air to virtually anywhere in the country. It also including to 13 of our specialized pathogen centers equipped to train in the care of special pathogen patients. It's been a top priority of HHS to be able to provide the safe transport of special pathogen patients while protecting the health of the responders and mitigating disease response. The PBCU is unique. It's the only technology of its kind currently available around the world that's capable of doing this. The PBCU is a clear example of the United States is leading the world in cutting-edge technology in this space. One of the other things I want to point out also is I think it's really important to understand that the PBCU was designed and manufactured entirely here in the United States. To create the PBCU, we use the same technology that the U.S. Department of State's containerized biological containment system leveraged with some enhancements. And that allows it to be transported not only by air, but by ground. So here today to explain more is Joe Lamana. He's the project lead manager for ASPR. Joe, come on up. Thanks.
Thank you, Mr. Knox, and thank you everyone for being here today. During the 2014 Ebola outbreak in West Africa, the Department of State and HHS, at that time the Office of the Assistant Secretary for Preparedness and Response, or ASPR, worked closely to repatriate 41 American citizens who were exposed to Ebola and brought them back to the United States. Initially to 3 designated medical facilities that had biocontainment units. Those 41 patients were spread over a 2-year period, allowing us to effectively manage limited transport capabilities and few biocontainment beds we had at the time. This outbreak generated a lot of discussion back here in the U.S. about our own preparedness and for a similar outbreak. Our domestic ability to transport and hospitalize individuals with high consequence infectious disease, like Ebola, was clearly limited. To increase that capacity, ASPR set out to collaborate with public-private partners to build the National Special Pathogen System, or NSPS, using a model similar to the other systems of care, like the trauma system. The NSPS is anchored by 13 Level 1 Regional Emerging Special Pathogen Treatment Centers, or RESPTCs, across the country. These RESPTCs are the hubs for future special pathogen responses. While ASPR expanded the biocontainment unit capacity in hospitals, the ability to provide medical transport for these patients remained a gap, especially moving multiple patients at a time over long distances. This gap has been highlighted in many exercises, and the PBCU fills that gap. The PBCU is a new capability within the NSPS to support American citizens should they become exposed or infected with high consequence infectious disease. The PBCU will also support the protection of the healthcare providers who are providing care during the transport. The PBCU is uniquely designed to move patients by air and ground to the closest respect. Additionally, the PBCU can provide surge capacity for the respect to increase the number of biocontainment beds. The PBCU can be used in the same way a hospital-based biocontainment unit is developed, provided there is trained clinical staff. The PBCU is the only domestic capability of its kind in the world. As you will see shortly, the PBCU is outfitted with a specialized support trailer for ground movement. It was also designed to meet airworthiness requirements on board an aircraft. With the PBCU, we can transport in various configurations up to 10 individuals. This June, the last week of June, we will be conducting an exercise, Tranquil Passport. Tranquil Passport is a large, full-scale transport exercise involving 5 cities, 1 international, 4 on the East Coast. Partnering with our Department of State colleagues at Operational Medicine, the exercise will move simulated high-consequence infectious disease patients to 5 of our respects. 1 here in the DC area, we have Washington Hospital Center, MedStar, and Johns Hopkins Hospital. We will going to New York City to drop off patients at Bellevue Hospital Center, and then we will proceed to Raleigh, North Carolina to drop off patients at the University of North Carolina Hospital, and then finally concluding at Atlanta with Emory University Hospital. Today you will get to see the PBCU here on a trailer, but on the 25th of June, you are welcome to come out to see the PBCU in action at Dulles Airport. You will get to see the PBCU inside of a Boeing 747 and watch the patients be handed off to teams from MedStar and Hopkins. And if you're interested, if I've piqued your interest on this, please reach out to ASPR Media at hhs.gov for more information.